Good morning, guys. As a part of results videos, we would like to show today about a diffuse pattern case. My patient age is 45 years. So there are a few videos we already made about diffuse pattern baldness cases. Less than 25 years or younger age, we don't recommend transplant in them. But whereas someone is above 30, definitely we can think about transplantation even though you are suffering from diffuse pattern baldness, because for them usually hair fall will be stabilized, and age after 45 there is no reason to wait for longer duration to get it in hair transplantation. That's a motto. Again, 25 to 45 is the age where we need to look better. Of course, most of the guys even above 45 also they really get it on transplants. Patient aged 45 years, diffuse pattern with a stabilized hair loss pattern. That's the reason we did the transplant and we achieved excellent density. Well, usually the diffuse pattern cases, what kind of challenges we usually face is we don't find much gaps in between the hairs. That's the thing. Whereas this patient with naked eye itself, we can see a lot of gaps there. When we are operating under magnification, we can find a lot of gaps to implant. That's the advantage of such cases in while doing the transplantation. Well, most precise kind of techniques has to be used, because we should not damage the surrounding grafts while doing the diffuse pattern cases. That's what we did in this case. We found a lot of gaps and we did a very meticulous way, so we could implant the grafts in between the existing hair follicles, so that after the results you will not damage any existing hairs as well, and we're going to get implanted roots also growth very well. Combinedly we can achieve very good results. That was the plan we had in our mind, and surgery went very well with whatever we expected before surgery. Then during the consultation, same way we could do. So we did the surgery very good manner, such a way that without damaging any existing hair in this patient. Well, after 9 months of the transplantation, we had a chance to see his results. So excellent natural hairline. If you can observe the natural hairline, very excellent, and density. If you can see even in the mid scalp and the crown area, also the blending style is very good, and that's the main expertise of doing transplant in diffuse pattern. So if you can see the top view, the even under bright light, even with kind of a good cameras flash, still we can get a fantastic density. So the blending is very good, and natural hairline and density of the overall is excellent. Patient is so happy with one session. We had done only one session, and he just followed a few multivitamin medicines almost 3.5 to 4 months, and nothing much we are given more than that. So, well, what in this patient in this kind of patients, what is the main risk is probably if they lose more hair in future, even in second session. Well, above age of above 45, usually the hair fall will be stabilized, but it can vary person to person anyway. Conclusion of diffuse pattern baldness patients is always we need to consider, if you have vigorous hair thinning and hair falling, definitely do not go with a transplant, because even if you do transplantation you end up in getting implanting and only 2500 grafts, and you will be losing more than 2500 hair. It doesn't make any sense, and you'll not be happy with that. So main motto is you should have a stabilized pattern of hair loss. That means there is no hair fall happening right now, and there is no signs of thinning of the hair that doctor would suggest you. If you don't have these two and you are above 30-35, then definitely you can go with transplantation. That's the important point has to be decided. Well, these kind of things probably as a patient you will not get to know. Kindly show to your expert doctor to understand what kind of phase you are in, what is your age, then accordingly we can recommend you best suitable options for you so that your transplantation would not go waste. That's the conclusion of the diffuse pattern baldness treatment scenario.